Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I'm here with my incredible and thoughtful co-host, Dr. Millicent Ravello, and we are thinking about butts today.
I was a little worried as to where you were going with that intro, given our theme.
Thoughtful. We're thinking.
Thoughtful.
Because there is a lot to think about now.
Yes.
There's been some interesting legislation that we want to talk about butts.
Yes. Butts are sort of having a moment right now, as if they ever were not in the recent past. But today we are specifically talking about Brazilian butt lifts, otherwise known as gluteal fat transfers, and the recent legislation and safety issues that have arisen with regards to these procedures.
And it is a hotly debated topic amongst physicians, plastic surgeons, legislators, patients.
Yep, medical boards.
It is such a highly contested and heated topic that we really have to spend some time on this.
Correct. And so where this is coming from is that recently there has been a relatively large number of deaths related to Brazilian butt lifts in South Florida specifically over the past couple of years, to the degree that the Medical Board of Florida has taken pretty drastic measures to oversee and reduce potential risks.
Yeah, I mean, this is a pretty big intervention into the practice of medicine.
Right. And perhaps reasonably so, because we've talked about this before when it comes to plastic surgery complications. Typically, death is not on the list of a plastic surgery complication. That is not something that any of us would ever really consider a actual complication. Does it happen? Sure, of course, there are instances, but that's not usually something that we worry about when we're doing plastic surgery, except for these Brazilian butt lifts. And there's a very real reason for it. So a little background, a little history into this procedure. A Brazilian butt lift is when you do fairly large volume liposuction, typically of the torso, but wherever you can get fat from, but typically the torso, the abdomen, and the flanks, and then you inject it into the gluteal region to create a more rounder, perkier, filled out, projected butt. And the problem has been, if that fat gets injected into a vein, the inferior gluteal vein is typically the culprit. It is a large vein that runs right under or through the gluteus muscles, and it's a direct shot into the inferior vena cava, into the heart, into the lungs, and a piece of fat will travel along that course and get lodged in a pulmonary vein or vessel, I guess pulmonary artery, actually.
At that point, it's the pulmonary
artery, yeah.
It goes from the vena cava through the heart and then boom,
into the pulmonary artery,
pumped into the lungs.
And when that happens, you can't oxygenate your lungs. The pathway for blood and for oxygenation is officially blocked. And it's a pretty immediate death. I mean, there have been some instances of patients being saved, but that typically involves being immediately transferred to a hospital, getting put on basically a bypass machine on ECMO until they can go in with an interventional radiologist or cardiothoracic surgeon and evacuate that piece of fat that's lodged in there. And unfortunately, that's very rare that can actually happen in a timely fashion to save the patient. So this is what we're dealing with when we're talking about deaths from gluteal fat transfers.
Right, and death should not be a percentage kind of complication.
No, not for plastic surgery.
No, it should be like death with plastic surgery should be like getting struck by lightning.
Right.
The odds of you going through your life and getting struck by lightning are so small. But it does happen to somebody. So that's what it should be. We're talking about numbers that have gotten the attention of everybody, to the medical board, to board of plastic surgery, to lawyers, to hospital corporations. They are definitely noticing the number of people that are meeting their demise with this type of fat transfer.
And unfortunately, not that death is acceptable for any plastic surgery patient, but typically these are young women. They may be young moms.